Welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Herodopoulos, and today I'll be discussing COPD, which is chronic obstructive pulmonary disease, also known as emphysema or chronic bronchitis. It is estimated that COPD affects 24 million Americans, and unfortunately, only 50% are diagnosed. COPD is a progressive lung disease that compromises breathing by affecting the airways and air sacs in the lungs. It is the fourth leading cause of death, and the number one risk factor for COPD is, of course, smoking. There are many misconceptions of COPD, which contribute to the poor diagnosis rate. Patients may misunderstand or minimize the symptoms, such as fatigue, shortness of breath, wheezing, and productive cough. Denial can also be a huge barrier to the diagnosis and treatment. Symptoms may be misattributed to asthma or just getting older. Some patients think that their morning cough is just a smoker's cough and ignore it as a serious symptom. By the time a patient has become symptomatic with COPD, they've already lost 50% of their lung function. A simple questionnaire like this one can help you evaluate to see if you may have COPD. It's a series of 5 questions, and if you score 5 or above, you may have COPD. Discuss this with your doctor. If it is suspected, the main test used for confirming the diagnosis of COPD is a technique that measures lung function called spirometry. It helps to exclude other diagnoses with similar symptoms of lung obstruction and can establish the stage of the disease and the treatment. COPD cannot be cured, but it can be managed and treated. Smoking cessation is the most important thing you can do to slow the progression of your disease, and it is never too late to quit. There are many treatments for COPD. Pulmonary rehabilitation can help patients improve their lung function and overall health. This is a customized program that includes exercise training, breathing exercises, and patient education that can help patients manage their COPD. A variety of medications, including bronchodilators, inhaled corticosteroids, and combinations of the two, like Symbicort and Dulera and Advair, can be used for preventing progression of the disease, as well as new medications called Spiriva, which is an anticholinergic medication that relaxes the bronchioles so you can take a bigger breath. Daliresp is the newest one. This one is for patients who have severe disease and decreases the amount of COPD exacerbations that may lead to hospitalizations. Some patients have such severe disease that they require a supplemental oxygen. It is very important that COPD patients are up to date with their influenza and pneumonia vaccinations and avoid people who are sick. For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.